Welcome to the stream, guys. How are you guys doing?
Hey, how's it going?
You guys.
Thank you so much for taking the time. Why don't you both start with an introduction on yourself and maybe your core thesis around peptides? Martin, why don't you go first? Oh, Max.
Okay, sure.
Okay, let's start with Martin.
Yep. So I'm the farmer bro. I represent the interests and the
Of the pharmaceutical industry.
I guess viewpoint of the pharmaceutical industry,
Sure.
including, but not limited to Pfizer, Merck, Eli Lilly, et cetera. I'm sure those guys love that. And
you're the face of pharma, whether they like it or not.
There you go. Sort of a self-trained biopharmaceutical expert. I think I can speak at a pretty high level about every inch of the pharmaceutical industry. I've discovered brand new drugs. I've acquired drugs. I've commercialized drugs. I've just about anything you can do in the drug industry, I've done it. And so I'm very concerned about the peptide craze. I think it comes mostly out of psychological issues, which we'll discuss. The need for identity, control, distrust of institutions, all kinds of things like that are leading to what we're seeing today.
Mm-hmm.
Great.
And Max?
Hey, I'm Max, former peptide skeptic turned peptide believer. I run a healthcare company called Superpower, and our thesis is that the health system today does a good job when you're sick. It doesn't do a fantastic job at preventing things and actually allowing people to be their best selves. I say a former peptide skeptic because they seem scary, and I say a converted believer because I spoke to dozens of doctors and heard hundreds of clinical vignettes from people who had their lives changed. Now, I don't believe all peptides are safe. I do believe we need more research. But I think there are a subset of things that have improved people's lives. I also think as a modality, peptides are one that are more interesting than before now that injecting is normal, now that wellness and optimization is normal, not just treating disease, and now that we have AI for things like computational discovery. So we're early, we need more research, but I think peptides are exciting.
Martin, I'll let you just respond.
Yeah, seems like
you have
you're
something
ready
on
to
your
go.
mind. But it would be useful to at least define the conversation a little bit more, because when we say peptides, we could mean Ozempic prescribed by a doctor for someone who has diabetes and is very overweight. It could also mean the Wolverine stack taken by a 15-year-old in a gym in Miami, right? And like, there's a wide gap here. So let's maybe narrow it down a little bit to probably off-label use. I don't know exactly where things start to get fuzzy for you guys, but defining a little bit more of where the actual point of debate, because I imagine that there's agreement with the extremes.
Yeah, I mean, isn't there a problem when we have to redefine semantics that have been defined forever?
Okay.
You know, isn't this like somebody saying, I'm using, GPT instead of using AI or something like that? Like,
Sure.
There's a specific meaning. Like, peptide has this very specific meaning, and they're not new. They're 80 years old. People have been using peptides forever. And in fact, in pharma, you try to avoid peptides because of their inherent weaknesses. You go for small molecules or really large molecules like antibodies. Peptides are sort of the worst of both worlds. So the idea that we've taken this kind of like last place drug class and then turn that into like the standard bearer for do-it-yourself medicine is kind of humorous to anybody who actually understands pharma.
Except that the last drug class has the potentially most impactful drug of all time, or set of drugs of all time, the GLP-1 receptor agonists. So I'm not saying we only have peptides in the toolkit. I'm saying the genie's out of the bottle, and we cannot ignore peptides as a tool in the toolkit. Small molecules, just like, I guess framing it for people who don't kind of understand the difference between these things. Small molecules are made synthetically. Peptides tend to be derived from what already is happening in the body. Right? DNA is the building block of the body and encodes for RNA, which produces proteins and peptides. So these peptides are naturally occurring. Now, it can sometimes be hard to patent a naturally occurring thing. You can, but it's a little bit harder. Small molecules, on the other hand, are things that humans design to block biology, typically block something that is happening in the body. And again, I'm not saying small molecules are bad, but they're kind of the two different modalities we're talking about here. And we've seen one category of peptides, GLP-1s, already change the world. And my contention is that there are other categories of peptides that are under-researched, but have really interesting kind of clinical vignettes that might change the world going forward.
Martin?
But I think like why we're having this conversation is because people are just, injecting a number of them into themselves now, and you're saying they might change the world, but people are going through the process of self-experimentation, and there's a bunch of companies, private companies, that are happily facilitating this and profiting off of it when it seems to be a large number of risks that are still unknown. At least that's my point of view.
Yes.
Yeah, exactly.
So,
yeah, I think that's right.
So maybe let's start with stuff that's not fully FDA approved. I think the canonical example would be like the Chinese peptides, the Retas, the stuff you buy online and inject, and it's based on some interesting scientific literature, but it hasn't actually been through the full FDA process yet. Where do both of you stand on that?
Yeah, I mean, why do you have a right to pirate somebody's intellectual property? This is the property of Eli Lilly. They discovered it. They spent billions of dollars on it. You want to steal it? You want to work with a Chinese company stealing it? I mean, that's not good for America. That's not good for the drug industry. And guess where do these drugs come from? They come from American R&D labs. And if you keep stealing them and pirating them in this like weird twilight DIY drug system, which is not very large, at least compared to pharma, I don't know if you make a big impact, but if it went very large scale, you would. I mean, you'd stop having drugs the same way pirating music would have huge ramifications for the music ecosystem. So you have to respect intellectual property to some extent. And then taking a retatrutide, which is just sort of a GLP plus, if you will, instead of just waiting for it to be FDA approved or like using Ozempic, I think this is like the worst risk-reward decision you could possibly make. It's like some of the decisions I used to make in the past. What is your upside to taking illegally manufactured retatrutide from some other place and you can't verify it, et cetera, versus just taking Ozempic? The people that take peptides and have these peptide stacks are mostly people in SF, maybe New York. They're very wealthy people. They don't know what the rest of the world looks like. Nobody else in middle America is excited to do this. It's not normal, Max, to inject yourself with things. This isn't like a thing everyone should be doing. And so, to me, the retatrutide case is really insane because this is a drug that Eli Lilly is going to get approved eventually.
Sure.
And the fact that there are people dying of certain terrible diseases, and they need compassionate use. They need to get on extension programs, but nobody needs retatrutide now. Right now, before FDA approval in a few months.
I think we agree on this. So I think the things we agree on are that the existing FDA-approved GLP-1 receptor agonists are an interesting category of drug, and they're a peptide, and they're impactful. I think we also agree that companies should not do things illegally and infringe on the patent for Reta, right? I do think the patent system incentivizes innovation. I think the crux of where we disagree is not, just quickly on this is an SF thing. That is not true. If you speak, I know dozens of people who own these research use companies. And if you speak to them, the majority of their audience is middle America, not SF tech bros, despite the tech bros being noisy on Twitter. I think the crux of where we probably disagree is the 14 or so peptides that RFK has said they might move from category 2, meaning they cannot be compounded, back to category 1, meaning they can be compounded. And I guess my general statement here is that people are taking these compounds, right? They're already using them at scale, right? And the way to minimize risk is to move them from category 2 to category 1, right? To legalize them. Because the risky thing is the dodgy supply chain we have today. The risky thing
isn't the risky thing just doing massive sort of unofficial, human trials when we don't know?
I don't think so. So I think that is true for peptides that we do not have longitudinal clinical experience and patient experience with. But let's take something like BPC-157, which is one of the most controversial ones. So let's go right to the meat of things. Let's take something like BPC-157. My contention is that thousands of doctors prescribe this. They do, and have prescribed this for 10
You can't prescribe this drug.
years. They give it to their patients, right? You can prescribe it, give you semantics, give it to their patients.
It's not a drug.
Thousands
Wait,
do
what?
that.
Hey,
Again,
no.
my statement is not the semantics of prescribing. My statement is thousands do this.
Okay.
My other statement is that millions of patients have taken this. At least hundreds of thousands, I believe millions, have taken this.
Yeah.
And that clinical experience, again, is not an RCT, but we cannot ignore it.
Yes, you
Right?
can.
We cannot
Yes, you can.
Okay.
You can
Okay.
absolutely
Wait.
ignore it.
It sounds like there's some sort of fundamental disagreement here about like the way BPC 157 is being distributed right now, because I know people that have told me that they've taken it. I thought that they were getting it prescribed or recommended to them. Like, Martin, what is your?
We can agree that it's being given to them.
I think
We
they're
can-
getting it.
they're
but,
getting it.
But
Given
what's
is the
actually
right word,
what's
yeah.
actually happening
It's
here?
being
How is
it's
this
being
happening?
out in the back alley.
Is that what's
They
happening?
meet in the back alley.
It doesn't seem like that.
Yeah.
It seems like there are doctors that do have
There
the
are many
ability
of the
to.
best doctors in the world. So when I was first introduced to peptides, one of the most esteemed doctors in the US said to me, Max, you take so many supplements. Have you explored peptides? Because I think they're a really interesting modality with a few decades of clinical use.
Sure.
Right? And when he said that to me, I was like, no way, this is bullshit. I'm not injecting myself with something. That was weird. So what I did is I went around to around 20 different doctors whose
Should
opinions
have trusted your gut.
whose opinions I respect.
Yeah.
And I asked them about peptides. And normally when you ask these doctors about anything, you ask them about red meat, you ask them about spinach, they're all divided.
Yeah.
Right? They're all like, one view, another view, punches. With peptides, just about all of them except one said these are really interesting. I have used these in my patients.
Okay.
I believe that endogenous molecules, peptides that exist in our body, are going to be the future of medicine. And those doctors have the incentive to not be wrong. If they're wrong, they could go to jail. If they're wrong, they can have their license stripped. If they're wrong, patients don't come back to them. So they have the maximum incentive. And for 10 to 20 years, they still give this to their patients, and their patients say, my life changed. Now, you might say it's placebo. My statement is the patient says their life changes, and the doctor sees that.
Okay, Martin, I want you to react, but I also want you to sort of set aside the intellectual property argument. I like that argument, but let's focus on the what doctors are doing, how BPC 157 is being delivered, that type of thing.
So I'm a drug hunter, right? People like me, Vivek Ramaswamy, we look all around the world for medicine to buy and medicine to put into companies that great firms like A16Z and Founders Fund and other more healthcare maybe focused firms will fund, take it to the IPO, which I've done before, and get paid huge amounts of money. That's what I do. That's what I'm good at. That's why I'm the farmer bro. BPC 157 is the biggest scam I've ever seen. It does absolutely nothing. There's no redeemable value to this. Do you know the story about it? Do you guys know? Jordy? No?
Please tell us.
This guy in Croatia made it, Sičić, my hinterland brother. And, you know, the only publications about this drug are by him. Nobody else has published about this drug. It's not a drug, in fact. Nobody's even confirmed that it's a peptide from the gastric juice, as he claimed. Nobody can find a sequence that matches that, and the gastric juice of human beings has been thoroughly profiled. It's a 15-mer peptide, so it's 15 amino acids. Half-life is minutes. There's no plausible physiological basis for it to work. And it's been in clinical trials. Pliva was a local drug company in the Balkans, very well respected, might add. Pliva actually licensed BPC and tried to do clinical trials for it, and guess what? They failed. So this like weird like I
do you
want to
think
be
it's
a doctor
placebo
too
effect?
thing is.
Do you think it's placebo effect? Because I've talked to people that say it's good for recovery, and I can imagine if you're sticking yourself with something, you might feel like I'm less sore today because it's just
While you are recovering, you think that the drug is helping you, and of course it isn't. It's the recovery process you're going through. And there's an app for this. If you want to make real money, go make BPC in CGMP conditions and go do a clinical trial, and you can be a $1 trillion company like Eli Lilly. Instead, you can putz around, buying fake Chinese stuff and then injecting yourself and dreaming that you're doing well. I have a drug here that if I take might also aid my recovery.
No, get that out there.
Should I try this? Should I tell you that it works
Why
for
do
me?
you
It's an
have
N
that?
of 1. Oh my God, I did so great with this N of 1. It healed my recovery. Like, this is nonsense. This is not science. Science is controlled experiments that are well done, very carefully documented, and so forth. Why are we going backwards? Why do we go forwards in civilization and society? What is this urge by the Valley, and I blame the Valley, to go backwards
Martin,
in time and space?
I hear you, and I think other people have it, and we don't know whether these are placebo or not yet. We can't make a definitive statement, and we don't have the RCTs.
Wait, but I thought you said there was studies done on BPC 157.
No, there aren't human. There are no human studies done.
There was one done by Pleva, and it failed. Pleva gave the
one
drug
study.
back.
There are dozens of studies of drugs that become commercialized that previously fail. Anyway, my view is we don't know whether it's placebo or not yet. That is true, and some people will say it's placebo, some will say it's not. My statement is really simple, which is you can have Martin's view, or you can have the view of thousands of doctors who have used this for 10 to 20 years and have their license on the line, the view of millions of patients who talk about their lives changing. You can have that view. My dad's visiting from Australia, and he's been taking painkillers for the past 4 months and can't walk upstairs because his back is bad.
Sorry.
He took BBC 157 for 3 days, and he said to me, Max, this is the first time in 4 months I haven't taken a painkiller. Again, I'm not saying this isn't placebo. I'm saying we don't know.
Yeah.
What I'm saying is I am God. I'm really happy my dad's not in a painkiller.
Yeah.
Right? My co-founder, he lost 3 organs in hospital. He had an autoimmune disease. They put him on biologics. He took BPC 157. He's off biologics, and he doesn't have an autoimmune disease anymore. Again, saying we need the study. We will put our money where our mouth is and fund the studies.
Put your money where your mouth is, exactly.
But we can't ignore the real world evidence. Again,
Well, you are ignoring it if you're not putting your money where your mouth is. If you believe that's true.
No, we are.
No.
We are.
Do a clinical trial.
We are.
Tell me about it.
We're in the process of chatting with the people required to set up a clinical trial for this. Because we will put our money where our mouth is. Because I've seen thousands of doctors, millions of patients, and even the FDA, right, who have said they're going to start legalizing this, even the FDA.
Okay.
But Max,
You can have your view, and I don't. That's okay. People will have that view. I will have an opposite view, and I'll put my money where my mouth is.
Max, you've never done a clinical trial before, right? You've never invested in drug companies before, but you want to do your first clinical trial on this drug, which you didn't invent. You've heard anecdotal evidence about. Why?
Because I have seen thousands of doctors, millions of patients, over 1 to 2 decades. Right? Go say to my friend, go back on biologics. Go back to hospital, lose another organ. Go say to my dad, go back on painkillers every single day. I don't want my dad on painkillers every single day. Now, you might say that's placebo. I say I don't know. But I say with the evidence that we currently have, I believe there is more to support the argument.
You should see what this galaxy gas does for me. It's amazing.
With the galaxy gas. Okay, Martin.
It's really good.
No, but what's your question? Is your question, Martin, more that like, okay, you
no
take...
pharma guy in their right mind would do this.
Well, hold on. So no pharma guy would do it. Max clearly believes in this. And what is the intersection of these two things? Is it possible to do the type of study that you're talking about with Silicon Valley backing? Is a $30 million Series A enough to get started? Or do you need to go to Wall Street, IPO, do the biotech thing?
No, you can. I mean, plenty of private companies do this.
Okay.
There's hundreds, if not, actually, I would say there's thousands of private biotechs.
Okay.
Generally, they would pass on something like this.
Well, yeah. So why? So there's this body of anecdotal evidence.
Unpublished evidence.
Yeah. So certainly a drug hunter would have looked at this already, right?
Martin, is your statement the only admissible evidence is an RCT?
Yes.
And what about all of the examples of when something works? Before anything works with an RCT, there's a time when it works pre-RCT. Do you deny that?
In animals.
No, in humans, there are times
in animals.
when before there's an RCT.
Yes, it does happen sometimes, yes.
Yes.
They're intelligently designed drugs that were designed to do a specific thing, and they do the specific thing, and then they work.
Yep.
This is not that.
And you think your singular statement of placebo outweighs again, we don't know, but I'm saying on the facts we have today, there is more to support the fact that this is more likely than not placebo than the alternative.
No, I would bet anything. I would bet anything. No trial of BPC would work.
Okay, I guess we'll see.
What else? So Max, is Superpower facilitating people getting BPC 157 today?
No, we won't sell anything that is not legal to compound. But I believe the FDA will make it legal to compound soon. And then we'll sell it. And I believe the FDA should make it legal to compound because the genie's out of the bottle. People have seen their lives change and they're getting it anyway.
What else are you excited about? Because when people say peptides with an S, so BPC 157.
Thymosin alpha 1 is fascinating, approved in 35 countries. I take it and I never get sick. I used to get sick 4 or 5 times a year. I had the most elaborate immune stacks. None of those elaborate immune stacks, the 100 things, placeboed me. Thymosin alpha 1, everyone around me had COVID a few months back, and I didn't get it. A bunch of people around me had influenza. I didn't get it. Every time I get a sore throat, I take BBC 157, thymosin alpha 1, and the sore throat disappears. Now, this is a drug that is approved in 35 countries, right? Has some human data. Now, pharma in the US hasn't brought it through trials because they can't patent something that had existed for several years. So I think thymosin alpha 1 is a really interesting one as well.
Okay, Martin, your reaction?
Yeah. Well, drug companies can and do patent things that have existed before. There's
I
a lot
agree
of
with
ways
that.
to do
I did not say that. I said thymosin alpha 1 in the form that is approved in other countries, they cannot patent.
Yeah, I mean, you don't even have to patent a drug, right? You can get 7 years orphan exclusivity, 5 years of NCE exclusivity. There's a lot of ways to make money in pharma. And pharma, if you haven't noticed...
So I agree with that. I agree that they could find some rare disease indication and use thymosin alpha 1 against that and get a patent. My statement is that they could not get a composition of matter patent for thymosin alpha 1 in the way that doctors and patients are using it today.
Sure. I mean, you can change molecules too. I mean, there's a lot of ways.
I know. Why would they
do medicine?
And so we're saying the machinery of the FDA requires something works. We see it in 35 countries. The only way to get it patented is we've got to change the molecule and spend $300 million to $3 billion. What is that? Like, what is that for a system? Right?
Yeah,
That's
I mean,
regulatory capture by pharma to me.
I wouldn't say that necessarily. I think that there are benefits to making drugs stronger. Like I said earlier, peptides are the weakest form of drug. They're not
except the best, but maybe the best drug of all time is a peptide.
Yeah, but it's one of very few. I would say 5% of drugs by revenue.
Today, right? 5 years ago, we didn't even have GLP-1s. 10 years ago, we didn't really have GLP-1s.
Peptides were and probably always will be a backwater just because they're very weak. They have no pharmacological properties that are beneficial, like a good half-life. And in fact, the naked peptide GLPs don't work either. They have to be heavily modified by pharmaceutical chemistry.
We know this is not true. There's an
Sure
FDA-approved peptide with a very short half-life, Semirelin. Thymosin alpha 1 has a very short half-life.
Yeah, there are drugs that can work. You don't need a long
half-life to have an effect. We know this. The FDA knows. 35 other countries know this.
There are some drugs that can work with short half-life, but almost every drug guy will tell you that you want a long half-life so you don't have to keep taking the drug. There are some drugs.
Correct, and that is fine. And we have methods now with science to extend the half-life of these compounds, and that's part of where the research is going.
This is called pharmaceuticals.
Yeah, that's correct. Yeah,
that's
correct.
what the industry is. We have an FDA for it. We have all these rules for it, and I don't think we should change that. I mean, these are the things that have made American pharmaceuticals one of the greatest industries ever. To start to move away from evidence-based medicine is it's potentially a very risky and scary thing.
I think the riskier thing is there being a gray market because the genie's out of the bottle and people are getting these regardless. I think it's far safer to get them through GMP-certified compounding pharmacies in the way that the FDA has oversight over, rather than the state we're in today, which is the gray market. And this isn't a debate between no peptide and legal. It's a debate between gray market or white market. And I contend white market is net less harm, net higher benefit for the US people.
I think we should treat them like we treat controlled substances, right? I mean, there's a very specific set of laws that states what you're allowed to traffic on interstate commerce or not. And you need a BLA or an NDA or a 505B2 to traffic a drug across interstate commerce in the United States of America. And that changing that, I don't think is useful or helpful. No matter how many people on Reddit think that they want to play Dr. House today, that's not something that they should be engaged in.
So this is why I think they need to be legalized, because I don't think what we have today is safe. I don't think people going to gray market pharmacies and injecting anything into their body is safe. What I do think is far safer and net lower harm and higher benefit to the American people is these things being regulated in Category 1 and produced in GMP-certified facilities and prescribed by doctors. That is safer. So the net harm reducing case is making these Category 1 and legal to be prescribed by doctors. Not all of them, but the ones where we have a sufficient safety signal and a sufficient effectiveness signal.
Well, there is an arbitrator for that already. It's called the FDA. I mean, why you want a second, I guess, special like special ed version of the FDA for drugs that didn't quite make it so clearly efficacious?
What I'm saying is many of these things the FDA might not ever want to research because the patent is hard, because they target wellness and prevention and human optimization rather than disease. And the FDA loves their cancer therapeutics. And my statement is if we have sufficient safety and efficacy signals, we reduce net harm by making them legal today. We reduce net harm. And try saying to the person who used to be in biologics with an autoimmune disease, you have to wait 20 years for something that might never be researched by big pharma, right? Try saying to my dad who was on painkillers for the past 4 months every single day that, you know what, this compound you took for 3 days that has been used for 2 decades, go back to your painkillers. Try saying that to them. And maybe one day pharma, maybe in 10, 15 years we'll research this. We don't even know. Say that to them.
Martin, it sounds like there's a sort of a mischaracterization of your argument that I'll let you push back on, that you're arguing that that the FDA has no problems, that the FDA is perfectly efficient. And that seems crazy. I feel like everyone's upset with every aspect of the government all the time. Are you saying that the FDA is anywhere near to the speed required to approve new drugs, new research as quickly as they could?
I'd say they're pretty good.
Really?
You know, I hate almost every part of the U.S. government,
Okay.
But that's one I do like, and I advise the U.S. government, and I feel like this is something that, you know, could not be further from our collective benefit. Companies love making money. It's capitalism.
You're saying you prefer the gray market? You think the gray market?
I prefer no market.
We don't have the choice of no market.
No, yes,
right?
we do.
The genie is out of the bottle.
What does that mean?
It's out of the bottle.
What does that mean, genie mean?
What that means...
We can arrest the genie. We can give the genie 20 years.
Cocaine in the 80s.
Cocaine in the 80s.
Yeah.
Doctors have prescribed these compounds, and they're doing everything they possibly can to get their hands on them. And that can be very risky. And what I'm saying is we have safety and efficacy signals in millions of patients with thousands of doctors in 10 to 20 years.
Yeah. So Max is arguing that, like, a war on drugs will not work. It hasn't worked in the past. It is impossible to. No. Because if it's gray market, that means illegal. Like Martin is arguing that we can arrest the genie, but can we, Martin? Can we actually arrest the genie? Because it seems like there's a lot of genies, and you had a product behind you that I think might be not legal either, and that was probably available in a corner store. And I know that there are dozens of illegal flavored e-cigarettes and vaporizers that come over and they make their way into bodegas all over the United States, and like this just happens.
And those things are provably harmful, and they still provably harmful things do it. I'm saying these things, doctors have their license on the line.
I don't think doctors I don't think doctors want to recommend peptides. I don't think doctors like recommending non-FDA approved drugs. I've never met one that did.
Well, I know thousands of doctors who do, and I'm saying
thousands of doctors. I don't know thousands of doctors. I spent my whole
thousands
life
is such a big number.
So many doctors.
And what I'm saying is, I agree they shouldn't recommend things gray market. What I'm saying is, let's legalize because that is net safer for the American people.
Yes, and Martin, you're saying that you can win. You're saying that if we hang out in the gray market, you think it's actually possible to shut down gray market activity. Is that true?
I think you can shut it down. And then I also think that we have a perfectly great system, which is the normal regulatory body we've had for 60 years.
Yes.
And creating, like I said, a new special ed version of it for drugs that couldn't quite get on the school bus, you know, is not something that we should do because we have a rigorous way to determine if drugs work or not.
Let's go back to the gray market. Let's get rid of all gray market. And my friend can go back on biologics. My dad can go back on painkillers.
You should.
All of the pharma can continue making hundreds of thousands of dollars from these biologics. Let's do that, sure. And you know what? We're not going to shut that. But you get what I'm saying?
Closing arguments.
One more thing. So Martin, your stance is generally that these drugs just haven't proven to be that good. They've been around for long enough that a bunch of smart pharma bros and sisters would have, like, you know, taken them through trials already if they really
we take a lot of bad stuff through trials.
Yeah.
You know, BPC doesn't even come close to the muster of a pharma bro.
Yeah. Okay. Okay. And so it's weak. You're saying there's a placebo that you think is probably real, but then what is the risk, right? Because if somebody's saying like, okay, it's a weak drug, I maybe get a placebo effect. Maybe it just helps. But why should somebody
Avoid
it entirely, regardless of if they're available on the gray market or on this new version of
I just think we shouldn't normalize making drugs in your bathtub. I think that there's no evidence that any of these things are well made. I think we should leave medicine to the experts. I think that's something SV is very reluctant to do. Many people want to feel in a world where maybe they feel like they're losing control. They want to control this thing, or in a world where we're losing confidence in government. We want to take this into our own hands. And it's just not the way to do things. Medicine has progressed dramatically thanks to the capitalist system and the biopharmaceutical system in league with the FDA, which doesn't always get it right, but is quite good. And thanks to that, we have drugs for cystic fibrosis. We have a cure for cystic fibrosis. We have drugs for SMA. We have these terrible diseases. And one last thing is that a lot of these people in SV, you're perfectly healthy. You're talking about 2 sick people there a second ago, but most of the people I know on these peptides, they're taking a modafinil. They're taking drugs for diseases they don't have. And this is not a great use of people's time or great for their health. And to some extent, the government does exist to help protect people from themselves and their own stupidity.
And then Max, you're planning to take BPC 157 through clinical trials. Are you planning to take any of these other peptides through?
Yeah.
And
so
then where does that ultimately go?
Yeah, so we're working with a handful of different biotech companies that are taking these through clinical trials. We're in the early days of setting that up. My statement is not anti-FDA or anti the machinery we have. I think it solves a lot of purposes. I just think it doesn't solve all purposes. And my statement is not that the current system is always perfectly right. I think when new data comes along, when new science comes along, when there's a dangerous gray market, we need to accept that the times have changed and adapt the regulation. It solves a lot of purposes. There are many parts of it that are exceptional, but it is not complete. And I'm saying that we should do what the FDA has said they're doing, which is legalize several of the category 2 peptides that have the strongest safety and efficacy signals, because that reduces net harm for patients and increases net benefit, even if pharma doesn't necessarily like it because they're not making money from their $100,000 biologic drug anymore.
Sure. Martin, any closing statements? It's been great.
Yeah, I just want to say pharma did try to develop BPC and failed.
Yeah. Okay, we went through that. It's a good point. Well, thank you so much for joining today. Thank you to you both. Everyone had a great time.
Good job keeping it civil, boys.
Yeah, very civil. This was
very civil,
fun.
very
We'll have to do
professional.
this again. The next time a new peptide goes viral, we'd love to have you both on the show, independently or together. Have a great rest of your day. Have a great week, and we will talk to you soon.
Great stuff.
Goodbye.